Hey guys, Brigham here, founder and CEO of Ways to Well, here with my co-founder and chief of pharmacy, Aaron. He's more than just a pretty face, he's the brains behind the operation.
Pleasure to meet you guys. Welcome to the team. We're excited to have you. We're excited to talk a little bit about what we're doing, what our passion is, and where we're going. We're excited about the alignment between Ways to Well and the future of medicine, the direction we're headed with the technology that we're bringing on, and the impact we're gonna make.
A lot of people ask, where did the idea of Ways to Well come from and how did it all get started? To be honest, after spending over a decade behind scenes in the healthcare space, I was able to see firsthand how broke the system was. And I realized it's not healthcare, it's sick care. And the people that lose are the patients that pay the premiums to the big insurance companies. They're the ones on the hook, while big pharma, big insurance, and big medical is laughing all the way to the bank. And at Ways to Well, I realized there's a way to do it better. And it's honestly not even that hard. All we gotta do is be honest, be fair, not price gouge patients. These aren't complicated concepts, but for the existing marketplace, apparently it is. And that's why I'm so confident in what we're doing here and that we can help drive patient lives, because we're gonna make healthcare affordable, we're gonna make healthcare approachable, and most importantly, I wanna make healthcare fun. How do we gamify healthcare? How do we make the patient a part of the experience, not just a passenger? They're a driver in their own healthcare journey, because that is where the magic happens. That is where we can truly help patients drive longer, healthier, happier lives. Can we help people live to be healthy, happy centenarians, play with their grandkids, and bring it to the masses at a price that even a single mom, single dad, the working man can afford? That's what we're doing at Ways to Well. That's what gets me jazzed up in the morning, and I think we can do it.
My passion for healthcare started at a young age. I saw as early as 7 the decline of my grandparents, one through mental health decline, others through metabolic disease, Parkinson's, and a variety of other health complications. I saw in a small rural community that I grew up in South Texas, there weren't many resources. There certainly weren't custom compounding pharmacies that could create unique solutions that serviced my grandparents' needs. I saw the gaps in healthcare at such a young age that passion for wanting to make a difference in people's lives started as early as 7 years old for me. And as I've grown and as my career has progressed, as I've gone through pharmacy school and worked in 100 different pharmacies in my career so far, I see that pattern continuing to persist. Those barriers not only exist in small rural communities, but they also exist in large cities just like Houston, Texas. And what we're trying to do today is deliver custom solutions that create unique treatment options for patients, that fill those gaps, that services those needs, and doing it now on a broader scale. In 2016, Brigham and I started Revive Rx Pharmacy. During that time, it was just me and him in a 10-by-10 office working on inbounding prescriptions, connecting with doctors, connecting with pharmacies, and trying to coordinate where a prescription was coming from and having it filled at another pharmacy that we had validated as providing an excellent level of service and quality product. And so in 2018, we launched our own facility.
If we're gonna provide concierge medicine to the masses that's scalable, predictable, and repeatable, helping patients get proactive and not reactive, we're gonna have to change the system completely. What are we doing at Ways to Well and Revive to do that? We're vertically integrating healthcare. The vision I have for the company is taking these various nuances of healthcare and putting them under one roof. By doing that, I can drive the cost down of healthcare and offer patients this quality care for pennies on the dollar.
Our focus is to try and create solutions that meet the exact patient's need rather than just treating them with traditional medicine. As we've grown this organization and grown Revive, we are now servicing 350,000 patients across the U.S., licensed to ship to 36 states, and working with over 1,500 physicians across the U.S. Our impact today is much broader than just the state of Texas.
What I'm envisioning long-term is Amazon meets Uber meets healthcare. I want to talk to you about why I think AI is so crucial to the future of healthcare. One of the major challenges that we've seen in the healthcare space is a chronic shortage of primary cares. It's experienced nationwide and is projected to grow. In fact, most of the statistics show we're gonna lose 30 to 40% of the healthcare providers in the United States. Why is that so important? Those providers are the front line. They are the only hope that these patients have at preventative care. If they don't see primary cares, they end up in sick care. They end up in the broken system, getting procedures or medicines that are pushed by insurance companies and big pharma. And that's not what we want for our patients. At Ways to Well, we're gonna do it different and we're gonna do it better. One of the big challenges of healthcare is providing great care for a cost-effective price and scaling it appropriately. How do we achieve those three things? One of the solutions is vertically integrating. What do I mean by that, and what have we done at this company to achieve that? We went out and built a state-of-the-art 503A pharmacy. This allows us to compound and manufacture medications and treatment options for pennies on the dollar. We've launched a telemedicine company in Ways to Well that is rapidly evolving into a digital healthcare platform. Today, we're telemedicine, but tomorrow, the future of Ways to Well is a digital healthcare platform. What do I mean by that? Through utilizing amazing tools and technological advances like AI, algorithms, chatbots, we're going to be able to offer patients not only a vertically integrated, cost-effective, best-in-class solution, but we're also going to be able to offer them 24/7 coverage. They're going to be able to order their medications in an instant. It's going to automate the entire process in the patient journey. And the goal is to help these patients achieve more and more for less and less. One of the things I learned with over a decade in the healthcare space, whether it was being a drug rep for Eli Lilly or being a device rep at Stryker, standing in the ORs from dusk till dawn, all the way to opening clinician-owned pharmacies and lab facilities that worked in the broken insurance model, I learned it's a beatdown and it's hard being an employee. And so I want to thank you for taking the chance and coming to work at Ways to Well and Revive and helping us drive this mission. Aaron and I firsthand have experienced how difficult it can be in a healthcare space where the hours are long, the workload's grueling, and the expectations are sky high. There's never enough hours in the day.
I'm a pharmacist. I've been a pharmacist since 2012. Before that, I was a technician for almost 13 years. And during that time, I've been in your shoes, many of you, whether you're a tech or a cashier. So I've been there. I know how it feels. I know the grind. I know the sense of feeling a lack of appreciation, that you're just part of the process and you're not really recognized. And that is not the environment we're trying to build here. Your voice matters to us. We want to hear about your challenges so we can build a better work environment. We're building a community of employees who have been through the ringer, have seen the other side, have worked in hospital systems, have worked in retail settings, have been through the challenges that insurance creates for our patients and know how challenging that it can be, and changing that environment so it's inviting, that you're heard, that you have a voice, that you can come to us with challenges and we can work to adapt and change. And to Brigham's point, nothing about this is going to be easy, but you're here because you saw the mission, you saw the vision, you want to be a part of something great, and we believe it too, and we're going to be here throughout the way to support you.
Aaron's assessment is spot on. The goal is to create a work environment that people are excited and passionate to come work at, because the patients are. The patients are ecstatic, and we're making a difference in the world. And we want you guys to know you do have a voice. Aaron said it, you have a seat at the table. We want to hear your feedback. I've told the employees in the past, I don't have the answers to the test, I just have the questions. You have the answers to the test, and we need your help. It takes a village to raise a child. It takes an entire corporation to drive the type of healthcare outcomes that we're attempting to do at these companies.
Thank you for joining the team. We're excited to have you. We're excited for the future of the organization. We're excited about the direction we're headed. We see the vision. We hope we can be along for the ride with us. You have a voice. We're here to support you. We're here to grow this and continue to grow and make the impact that we want to make. Thank you.